A very warm good afternoon to our guest, Dr. Soumi Dutta, Associate Professor and HOD of Department of Computer and Computer Application at the Institute of Engineering and Management, Kolkata. To the faculty members and to all present here, I, Priyanka, welcome you all on Center for Climate Change and Water Research at Suresh Kanvihar University on this esoteric FDP on information retrieval in post-COVID-19 in the light of data analytics. We are very delighted and eagerly looking forward to have you all involved in the quest of embracing this knowledge. Today's webinar is on the information retrieval and data analytics that are playing a significant role in understanding the spread of disease COVID-19, as well as understanding the effectiveness of our different response to diseases. Based on various machine learning and deep learning approaches, many researchers are contributing in prediction of COVID-19, such as feature selection on clinical features in terms of identification of COVID-19, reduction of future waves of disease for future prediction, COVID-19 as an impact on the field of medical sciences. Due to the massive spreading tendency of these diseases, the online medical learning environment has become a new essentials. Now, with this, I would like to call upon Dr. Varun Narayan Mishra of Center for Climate Change and Water Research to take forward today's event with a welcome address. So please.
Okay, thank you, Priyanka. Good afternoon to all of you. Good afternoon to our esteemed speaker of today's FDP, Dr. Soumi Dutta ma'am, all the participants and students. I, Dr. Varun Narayan Mishra, on behalf of Center for Climate Change and Water Research, Suresh Kanvihar University, welcome you all in one-day faculty development program on information retrieval in post-COVID-19 in the light of data analytics. Our center is extensively involved in the research and development in the field of geoinformatics and its various applications in earth sciences, forestry, ecology, environmental sciences, agricultural mapping, urban land mapping, and other things. I hope today's faculty development program will enrich our participants with the recent developments in the data analytics like machine learning, deep learning, and other data analytics techniques to solve the real world problems, especially in the digital world. Recently in the digital world, the development of recent machine learning and deep learning techniques have opened a new era, have opened a new tools and techniques to retrieve the information. So I will not take much time. I will invite our esteemed speaker, Dr. Soumi Dutta ma'am, to start her address. Yeah, Priyanka.
Yes, thank you, sir. With this, I would like to take a brief opportunity to introduce our esteemed guest, Dr. Soumi Dutta, Associate Professor and HOD of Department of Computer Application from the Institute of Engineering and Management in Kolkata. She is a gold medalist in BTech, IT, and MTech CSE, both in Techno India Group. She has completed her PhD degree from the Department of CST, IIEST Shibpur, and her research interest is in data mining, information retrieval, online social media analysis, and microblogging, summarization, and so on and so forth. She's a TPC member in various international conferences. She's a peer reviewer of different reputed international journals. She's a member of several technical functional bodies such as IEEE, MACUL, and many more. She has published several papers in reputed journals and conferences. She has 2 patents under her belt on system and methods for solar-powered washing machine for industrial purposes and sensor-based artificial limb for physically challenged people. With this note, I would like to call upon Dr. Soumi Dutta to take this event forward. Ma'am, please grace us with your knowledge, ma'am.
Thank you, Priyanka. Thank you, Varun, for this warm welcome. I'm very thankful to Dr. Suresh also, who has connected me with this such honorary event. So I would like to just start my presentation today. I think my presentation is visible to you all. Definitely. So my topic is today, as you have also mentioned, that is information retrieval in post-COVID scenario. So basically, and I want to highlight also that how data mining or data analytics is specially related with this fact. So remembering all this thing, I'm just starting my presentation. So definitely you can see that what every time in all over the world we can see, is my screen is changing?
No, ma'am, not till now. We can see your screen.
Okay, okay. uh, I think, is it changing now?
Uh, till now,
No, I think it is not changing. Just
yes,
wait.
ma'am.
Yeah, now it's changing, I think.
Yes, ma'am. Yes, ma'am. Now it's okay.
Yes. Okay. So let's start with the after the starting slide. I'm just starting with some highlights of mine. I will not take much more time. Already you have told a lot. So basically, I have completed my PhD last year, 2019 itself, and I have completed very few journals. I have done very few conferences. I'm attached with some very organizing team of very newer conferences, and apart from this I have completed various trainings, and also I am trying to do some few of the patents. Already 3 patents I have done. One was not mentioned in my short profile. So just moving to the next part, that what we can do, what is my main topic, which is COVID. And I don't think COVID needs no introduction specially. Okay, so basically, why COVID and why we are taking COVID-19 is a disease. Basically, it comes from the coronavirus SARS-CoV-2. This is the name of the virus. WHO first came to know or learned that this new disease on 31st of December 2019 itself. And initially from China, we got to know about this fact that this is the virus which is not a viral only pneumonia. It is having some more features than pneumonia, and the new virus was invented basically in Republic of China. So as we all know that currently there is no person who is not aware of this fact, that these are the some common symptoms which are having, like fever. We can have fever, we can have different sort of cough and cold, we can have lack of smell, lack of taste. These are the few features what COVID-19 is having. So how it is giving the effect in our social life? So basically, in my respect, it is having some good effect, and also it is having some bad effect also. So within bad effect, definitely the bad effects are more, basically. So all the schools are closed, all the colleges are closed. From our academic point of view, we can see we are not being academic person, all of us are academic person, but still we cannot go to the colleges or go to the schools. And if we are going also, students are not coming. So there is a huge gap which is creating in all over the world. There are several, the overall economy is being affected by this one. But still there are some good factors we can stay back at home, and we can at any time, any point of time, we don't have to travel, much more headache for travel, and we can easily give more time to our family, as well as the time we are saving, we can do some more creative works also. So, and not also this thing, say for example, now this for this occasion, previous time we thought something less about this online webinar or online sessions. Now we are more addicted to this one, because we know good speaker. Previously, at the time of conferences, we try to invite all the good speakers from different states, different foreign countries also. Now it is very easier for us at any point of time, at maybe at night, it may be at the morning, we are connecting with each other very easily. And this online mode, previously in corporate culture, it was already there. They connect with their clients at any time. They're having client calls at the midnight also. So we are also getting accustomed with this sort of features, and we are also the same culture we are incorporating in between ourselves. So I think these are the some good factors which has happened in between us. And digital scope of digital marketing is also increased. Now these are the few effects which are the mixed effect and bad effects also coming. That is, every time we have to sit back with our laptops, with our phones, we cannot just come out from all these gadgets. So we have become many times we have seen, at leisure time we try to see the mobile, but at the current moment, every time we have to go and check in our official groups that what new things are coming, whether I have to do any new assignments, whether anything has come or not. And not only for us, for our child also, we can see the child generation, they are also getting more affected. Previous time we are quite restricting them that don't see too much mobile, it is affecting you. But now the study has become there in that such a level that they also have to just get addicted with this mobile factors. So we cannot skip them. So quite it is there, it is affecting their mental health. And at the same time, they are not going out, they are not playing, so definitely it affects the physical activities are very gone. And at the same time, when we are spending more time on the mobile, on the digital world itself, the spammers, the hackers, they are also not sitting right back. They are also getting more and more users in their platform, where they are getting the chances of bullying and chances of scamming are quite increased. So that's why these are the few mixed effects what we can see in due to COVID, basically. Okay, now come to the global scenario. This is the global scenario from who actually I have taken this data, the Worldometer. Worldometer is a very common website in this entire lockdown period. All of us, I think, monitored this data, that how many countries, how many person are getting died, how many person are recovered, how many person are active cases are there. So as so much data we are getting from there, also we are having a lot of chances to and analyze all the data and to come out with some new outcomes, so which can help us a lot. Okay, so okay, very sorry. So this data has come to our place a lot. Just a minute. Yes, I think my screen is visible now, right?
Yes, ma'am. Yes, ma'am. It's visible.
Okay, okay. I'm very sorry for this interruption. Okay, so just coming to the next slide. So these are the already we have seen, these are the already these are the factors what we have seen. So this data what we are getting populated from different websites, it is helping us a lot. So basically using this sort of data we can actually find our own statistics, and we can apply the information retrieval algorithms, we can apply the data mining algorithms, and we can come up with some new factors. So data are not only for giving us only the statistics. If we have to find information or valuable information, this data is going to help us a lot. As I know that this is an FDP, so definitely like other FDPs, I have attended many of the FDPs where speakers come and try to say only what are the works they have done, and showing some difficult calculations, they try to explain their work only. So my motto is not that. Here in this platform I will try to highlight that still now various researches are going on, and what are the scopes are still there, what are the work we can do using data analytics. Few of the areas I will try to highlight basically in my this lecture. Okay, so first of all, as I have mentioned, that information retrieval. So what is information retrieval? So information retrieval means whenever we try to communicate with each other, like in conventional mode or direct access mode. So it can be some effective communication, it can be two-way communication, it can be some centralized communication. Whenever we do some communication, we are trying to communicate each other via some digital media or via some digital platform also. Every time we try to share some information, so it is the source of huge data collection. When huge data are getting collected, then what we can do, we can utilize this data to find out some meaningful knowledge from that data. And information retrieval works here or plays here some important role. So whatever the data are getting generated, from that data when meaningful information are coming out, then we can say this is information retrieval process. So in this regards, I just want to highlight few of the things. Today I am going to highlight that prediction of COVID-19, that in such different sort of features we can find out which are the clinical features. As we know, this is a disease, so it is having some clinical features, and based on some supervised unsupervised challenges, how basically this technique is coming out, how we can do some research on it. Next, I want to highlight that reduction of feature waves of COVID-19 for disease intensity prediction. So how, if already one disease has been highlighted, so definitely, or as disease is identified, then definitely we are having the chances to predict something more. The future we can predict, and definitely we can try to find it out that what are the future predictions, and we can how we can stop this. Because if we know the future predictions, then only we can stop this and we can take some precautions or measures. Next, automatic detection of some deformed area, because in clinical features, every time if we try to depend on some person who is a doctor, every time we know that for same type of disease, all the diagnoses are not same. So that's why every time, instead of depending on a particular doctor, if we try to create some automated system which will help us to detect this COVID-19 from the chest X-ray, like which is the general flu, which is the pneumonic, and which is the COVID-19. So definitely we have this sort of scope also in research, where we can contribute our knowledge. Next, we can see that online medical learning environment. As we know, as I have tried to highlight this point here also, that medical area is such an area where definitely we need some lab. If I'm telling a doctor that that only you read the books and you try to find out the outcomes, and you tomorrow you just open a chamber and try to diagnose the patients, then this will not be corrected. So definitely in medical learning environment also has been changed. I want to just highlight something. If you as we are trying to collect few of the data, so definitely we can work on so this topic. Next, the role of healthcare is totally changed. Nowadays, we know that many times we are taking some online appointment from the doctors, and also we are trying to diagnose. So how the automatic prescription, how the chatbots are working on this also we can work a lot. I will in detail I will try to explain each and every topic what I'm trying to highlight here. And apart from this, today one of the very important major role plays in our life, that is social media. Every time we like to, if we go to a coffee shop, then also we like to give some update. If I'm suffering from COVID, then also I'm giving the status. Every time we are quite related with the social media, because we cannot come out from home in the lockdown period. So if we have to get connected with everybody, so social media plays very important role. And not only with our friends, with our relatives, how the celebrities are reacting, how one politician is reacting, how the global scenario is actually reacting, so that also we came to know from the social media. That's why every time we try to have huge post on social media. So when social media having a huge source of information, then this how this information we can regulate, then this is one of the very challenging role. And at the same time, when all of us are just trying to share all this information, the spammer are not sitting right back. They are also having good scope to perform their functionalities. Every time you can see, I will show you a few of the examples. They are also trying to disturb us. They are also trying to ridiculously, they are trying to mislead us by some fake newses, by some fake informations. Okay, so one by one I'm just going through in all the matters. So first let me start with the prediction of COVID-19, that's such as feature selection on clinical feature based on some different techniques. Okay, so as we know, first of all, when why I'm trying to mention this point, feature selection, because when this particular disease has come to the market, then definitely we can easily say that when this particular topic has come to the market, then easily we came to know that what is the disease we have to identify. First of all, we need to identify it from the symptoms. We will go to the doctor and we will tell that these are the symptoms what we are having. Now, if we tell the doctor initially, we can see there are some overlapping symptoms. So initial phase, a doctor cannot identify whether it is a COVID or not. Now the situation is like that. If you are telling a doctor that if you are having flu for 2 days, doctor is suggesting you that, or you are giving some more extra symptoms. If you are telling that you are having some dry cough or like short of breath or like this, they will be telling you, you please go and visit to a visit for a COVID test. But initially when it happened, then it was a totally unknown scenario to all of us. So in case of learning, we also know a technique in case of data mining, that is called machine learning. Machine learning is what we are trying to create a computational model where we will be giving the training to this particular model, and this particular model will take some new decision. When the new decision have to come, then it will try to act accordingly. It means from its prior knowledge, it will try to identify the problem. So basically, we can also just compare this disease with these three sort of learning.
Excuse me, ma'am.
Yes.
Sorry to interrupt.
Yes,
Ma'am, your slide is not changing, I think.
Yes, it is changing. Now it is changing.
No, ma'am, we are able to see only this slide of effects of COVID-19. It's not changing, ma'am.
One thing.
Yeah, yes, now it's changing, ma'am.
Okay. Now is it now can you see the a page where some learning technologies are mentioned?
Yes, yes, ma'am. Yes, yes. Now it's visible, ma'am. Learning different
Okay,
models.
okay, okay. Very sorry for this
Okay. Sorry,
interruption.
sorry to interrupt, ma'am.
uh, no, definitely. So this slide, actually I was telling that we are having some common methodology which are basically quite overlapping with flu, some other cold, allergies. These are the some common methodologies what we are having now. I'm trying to compare this exactly COVID case with some three different sort of learning in the machine learning. So unsupervised learning, first I have mentioned. So what is unsupervised learning? Unsupervised learning is such a type of learning where we don't know that what when I'm giving a problem to the machine is quite unaware of this fact. So machine is trying to definitely machine is trying to identify the features, and it will try to definitely identify that what COVID models will be. So first of all, when some patient is going to the doctor, initial level, when the disease is not identified, then this case can be under unsupervised model. The doctor will initially try to identify, they will giving different sort of tests, and then from this test a new scenario will be coming to the doctor. So this is the case of unsupervised model. It will go to the doctor scientist, and then they will try to identify what is the exact type of virus, what are the nature of the virus, what are the nature of the symptoms of the all the this sort of disease. So then it will come in this way. Next, when we will try to find out that supervised learning, nowadays how the scenario is, we can say this is a supervised learning. In supervised learning, what we can say, we know or we are quite aware of the fact that if these are the symptoms, then definitely we can say this is a COVID-19 patient can have these are the scenarios, and they can come out with some solutions. In the next case, also we know recently some new strands of COVID-19 has come up. So what has happened when some new strands have come up? So definitely some new symptoms can also come. Nowadays, many times we can say a person is having only flu, no other symptoms is there. In that case also, if you go for test, it may be happen that person is having some COVID positive. So the symptoms is not same. So this can be considered or treated as semi-supervised learning. I'm suggesting you, please you go through zero-shot learning method, which is a very important or upcoming trending topic, you can say, that when some supervised learning concept is with us, also we are trying to embed some new continuous upcoming models. We are trying to embed this thing. This is semi-supervised learning. Also, you can search in the Google with zero-shot learning. Very few papers you will be getting on this, and there are huge scope of research. So definitely you can just come up with this. Next, you come the role of data mining and machine learning in detecting and diagnosis of novel coronavirus. So if you are trying to already, the doctors can identify or trying to detect the COVID-19 from the medical process, or if we are trying to identify, create a model like machine learning, we are trying to detect the particular disease. Then if you're trying to detect a disease, then definitely the first thing can be happen, we can be cautious and we can take help of pre-diagnosis. Say for example, if I'm suffering from COVID in my age, maybe I'm not lacking of my breath, so every day I should measure myself that with the I should check my SpO2 level and everything, then accordingly I can take care of myself. So these are the precautions, what we can say. Accurately we can diagnose, that's why in proper time it is too much important for a disease to detect. And definitely here data mining and machine learning role can play an important thing. Already what generally we try to do in our regular life, we try to say the symptoms and everything. So this is basically what we are trying to do manually. Okay, so in machine learning also we can do using some automated model. Automated model, if you put your age, if you put all the data, and if you put all the symptoms, they can give you this sort of symptoms. You can see nowadays too many application or many dashboard has come which can help you for this one. So these are the basically machine learning techniques. These will say you the probability, and also at the same time these will say you that whether you need some hospital diagnosis or you need some at home, you can definitely cure yourself. So that's why these are very important in case of prediction or in case of detection. These are very important. So this is a very easy learning model as I was talking about machine learning. So I have given you example of very easy prediction learning model which can help us. You can take several data of COVID patient and non-COVID patient. So these are basically available in the Kaggle. So you can see in different websites also nowadays, different researchers, when they research in the ResearchGate, in the Google Scholar, they try to share their data also along their researches. So you can easily download different data. You can try to use different sort of classifier. Different tools are there like Weka, and different tools are there. Easily you can classify. You can take a training set, you can take a test set, and you can classify whether you can predict or not. So these are the things which already has been built up. Okay, if you want to create your own classifier, that is also very fine. You can come out with some new strategies. And apart from this, I will also insist you, if you are not preparing any sort of new upcoming models which is a trending, quite very few research you can find on this, that when a classifier you are trying to execute, each and every classifier has some merit. So try to use some ensemble techniques. These are the ideas I am sharing with you. You can definitely research on this and you can find out, you can come out with your own paper. So for example, as a classifier, you are taking naive-based classifier. You can take whether my slide is visible. Whether my slide is visible. Am I
No,
audible
ma'am.
to you
No.
all?
Yes, you audible, ma'am. But the slide has just gone. You know, the moment you start, it just
Yes,
got
yes, yes.
disconnected.
Okay.
Dr. Dutta, there is a
Okay.
problem,
Yes.
I think, with your slide. Some kind of a synchronization problem is there.
Yeah, it is coming, I think, right?
Yes, ma'am. Now it is visible
Yes.
again.
Okay.
Now it's fine. Now it's fine. Thank you.
Okay. So definitely you can do this sort of research, because you will find new classifier maintaining is definitely difficult sometime. If you think that so many classifiers are available, you can take some in ensemble classifier. So in ensemble classifier means what? These are the some research suggestion what you can use, and you can totally build up your own classifier. Ensemble means what are the merits you are getting from different classifier, you can combine and create a new classifier. Okay, so in that case you can take help of different sort of classifier, like you can take help of naive Bayes, you can take help of logic boot, you can take help of decision tree. Different sort of classifier help you can take, and you can create one embedded system or one system where you can definitely create your own system. Okay, so next, come for the next slide. This is one suggestion how you can proceed your own work. So I'm showing you few of the graphs what are basically showing you. I have tried to execute few of the papers I have written on COVID, and it is showing you how the outcomes are coming. Okay, so me and my team has worked on this. Few of my students are also included. So when we are going through in the month of December, in month of January, in month of February, when this particular COVID has started in different countries, not in our country too much, and from the March when we have faced the lockdown also. So what will be the, how many people will be affected every day, day wise or month wise? This sort of analysis you can do, and you can come out with some solutions. Okay, next you can do what? Next you can come out, this is this right in the left side, what graph I have shown you. In this graph it is shown that how this sort of outcome is coming with you. Next you can see that I have tried to show you one time series, lockdown time series prediction and lockdown effects. So basically this graph is showing you that in coming 100 days how many new people will be getting affected. So you can see there are two lines are showing here. One is blue line, which is the actual one, and another is orange line, which is the predictive one. So definitely it is quite we got very good outcome for this one. We got 98 to 99% accuracy for this work. For different country we try to apply and we try to predict based on different waves what are coming, and we have seen that how many people are getting affected in coming 100 days. So based on this, basically this data are required. When this data are required, not only for your research, whenever we are researching, we need to keep this thing in our mind. We are not researching only for our benefit, only for the people that we have to, we will just find out a paper, we will upload it simply in the Google Classroom and Google Scholar and in the ResearchGate. So definitely whenever we are doing something, it always have a social impact. How? Basically when this sort of analysis are being done, and if this sort of, actually government also used to take the decision based on this sort of analysis. You can see that at the first step, when the March, they have given us Modi declared, Sri Narendra Modi declared the lockdown of 11 days or 15 days, I guess. Then we didn't know that for 3 months or 4 months we will be right back at home, and school will be open closed for so many days. We didn't know. So how it has been decided that next phase of lockdown, how much lockdown will be there, whether it is a strict lockdown or whether it is a some lockdown mode that in the night section it will be completely locked down, at the daytime few shops will be open. So based on this sort of data analytics, actually they are trying to do. Some team is there who is working with the government, those who are highlighting that in 100 days, previous days this has happened, and in another countries when first wave has happened, these many number of person got affected. So we have to take this earlier precautions, and that's why we can easily come out with some new solutions. So based on this sort of data analytics, we can easily say that new data outcome or the lockdown phrases we can easily come out. So that's why here is the importance of the computer science. Here is the importance of the data analytics, that we can help in decision making of the government, of the system itself, what is around of or what is in the society it is going. So you can see this is one of the outcome also I'm showing you, where in the US we know it has got affected quite badly. So, and in the middle time when they are having some number has been quite lower, then also we have seen they have tried to open all the schools, and again so many cases has been come out. So some day wise analysis here also we have tried to show in March, that how they have tried to increase all this thing. So this sort of with this sort of outcomes, with this sort of statistics, definitely you can come out with some papers. Okay, so next see some other factors, that how the data is also affecting every around. So whenever we are trying to analyze the COVID data, if you get the in Kaggle, there are very good data set I have still downloaded and I have tried to work with it. You can see that every segment you will be getting in detailed data. Say for example, if you consider of Delhi, so in Delhi how many people are affected, within that affected people, how many aged person are there, how many person are quite young, how many child are getting affected, what are their sex, whether they are male or female, whether the person are suffered from some diabetic or some blood pressure is there, or they are having some oxygen saturation level, what is the oxygen saturation level, everything you can get in details data. Or if you get some in details data, definitely whether this person is smoking, or it is, as we know that COVID is just affecting our lungs, so whether who are smoking, who never smoke, or who rarely smoke, how it is affecting to them, this sort of data you will be getting. So if you will be getting this sort of data, you can easily create a model which will be a machine learning model using your different sort of classifier, or your ensembled, or your predefined some your own developed classifier, and you can easily predict the future. So easily, if we can predict the future, then only we can take some precaution, right? So for this reason, definitely our analysis, our data science has some social impact, so definitely we try to do the same. You can see that if a person has asthma, if a person is having some COPD, hypertension, obesity, how they will be affecting. And if a person is having COPD, also the age is quite lower and age is quite higher, how this is affecting. So all the statistics easily you can come out, and you can test with different sort of data set. In Kaggle you can separately get data set, test data set, training data set, and you can work with this. So definitely these are the opportunities for you where you can work. And these sort of outcomes we have also come out from the different sort of data analytics, that actually it has been seen that males are getting more affected and females are getting less affected in COVID. And the death rate of male is also very much high because of there some hormonal changes. And also if you just go for biological analysis, they have shown the biological analysis why because the protein structure, their DNA protein structure, their hormonal structure is like this. That's why the particular disease is affecting the male more and more. Similarly, there one statistics has been given based on different sort of country. You can see here how coronavirus has affecting different sort of countries. Here this is a challenge, not only the person, only we have to look into the COVID situation and the diseases. Also the COVID has good impact and bad impact in our nature. So many person in this lockdown try to open new business, and in many cases we have seen people are losing their jobs, people are switching to another job, and people is higher risk. So this particular diagram is actually showing you we have different segments. We have, say for this scenario, if a person is doing the business of sanitizer and mask, definitely we can say that this is quite beneficial one. And different in different sectors, we can say the marketing, the profit amount is has been totally cut down, totally stopped, it has been. So based on this, they can take a decision that what, in which sector you have to invest. You can easily decide that in which sector you can invest. If it is about share market, so then also you can do this sort of analysis, that which are the share prices are lowing, because we know in share market when share price is lowing, you can buy a share, and what will be the impact in our next 5 years, that also you can impact. The financial people, those who are the from the MBA section, or those who are doing the work in the financial statistics, they can have this sort of area in research. They can easily do this sort of prediction with collaborating some computer science people, and they can come out with some new researches. Okay. So next, go for my next slide. Here I have just tried to show you that where biomedical engineering and the computer science can work in a handshaking mode, that always when we generally what we do every time we try to just I'm giving you one example, then I'm coming for this x-ray. Say for example, you are having a problem in tooth. Okay, in your tooth you are having a problem, you think that you need to fill up your tooth. So what usually used to do, you have to go to a chamber. In the chamber, the doctor will do the x-ray, and from the x-ray plate they will try to identify, no, these are the areas which are affected, and then they will try to remove your cavity from that section. They will either fill up, or they will either try to give a cap on this way. Okay, so there is, if you go to a different doctor, the amount of portion they will try to remove, that may vary. So actually there is no rule basically that which portion, or no automatic computational model that which can help them that please you remove this portion only. Okay, so that's why you can easily identify, you can work on different sort of section where the deformed areas are identified. Okay, so chest x-ray is also like this. If you go for the chest x-ray, in case of general flu, in case of pneumonia, in case of COVID, you can see the deformed area are quite different, and deformed areas dimension cannot be identified specifically using some regular dimension. So it can be circular, it can be box sort of thing, it can be totally any geometrical figure which has no particular dimension. Okay, so that's why here you can do a lot of work. So which area is affected via flu, that you can easily apply. And the dimension detection using different method also is one of the area of your research. You can give your contribution, you can easily work on this. Those who are really interested in machine, in the work of image processing. So I have recently done one work, and I have communicated in IEEE that how the dimensions are detected in some cases where the no proper geometrical dimensions are given. You can use box plot item, differential box plot, different sort of algorithms are there. You can also apply your own algorithm to identify the deformed area. So if we can create a system that where the deformed areas are identified, and it will differentiate you from other sort of flu, that in other flu, in pneumonia flu, these are the cases, but in case of the flu which is happening in case of COVID, then the flu type is quite different, then definitely some automated system can help you out for this sort of outcome. You can see in x-ray, in ECG also, when we go for ECG, the technician is doing the ECG. Sometimes if you ask the person whether everything is fine, he or she cannot answer. So basically the system they are using, there are no provision of telling this thing whether there is a blockage or no blockage. So only when the doctor will see, doctor can definitely tell you the reason. So definitely we have a lot of chances to identify, to work on this sort of images which will give you focus, which will give you a lot of opportunities where you can easily work. Next, come for the section. Here I have just tried to find out the correlation with my previous slide. If you can identify that these are the features of the chest x-ray dimension, if this is the factor which can happen in case of multiple COVID patients, then easily we can create a trained model. And if a model is already trained, then definitely we are having a lot of experiences. When the new system will be coming, when the new particular cases will be coming, easily we can say, so these are the cases where we can easily say that we can easily find out the disease, what we can see. So this is one of the case what we can see. Next, come for the section. You can easily see here that I have tried to show you here different sort of pictures what we can see, and in this picture only we can easily see that how a healthy mnemonic picture will act, how a non-healthy mnemonic picture will work, how the mnemonic picture will work, how the COVID picture will work. So these are the few cases already we have seen that how we can differentiate different sort of images. So if you have the image, now you build up your algorithm and you can easily come out with some different sort of outcomes. I will show you few of the outcomes, different work that what I have done. So here also you can see the differentiation you can easily do between a COVID patient and between a pneumonia or influenza patient, how the viruses are looking, how the symptoms are coming, how the chest X's are coming, and how the different factors are basically working. So using all these things, you can easily create some system that using the after the test, your system can predict the outcome. Okay, so these are the things what you can do many times. This sort of projects you can do, which can help the medical ground also in a very good way. So you can see that already I have mentioned another topic, that online medical learning environment. So online medical learning environment is such sort of environment which are not basically fulfilled by some online sessions. So online sessions is sessions definitely where you can do different sort of classroom studies actually you need, but still our doctors are doing. In Kolkata, I know that medical college has been open, because still now it is not working anymore. They are trying to, doctors, nurses, they are serving our patients, and at the same time they are trying to give the medical studies online, but few lags are definitely there. So that's why in few of the states I know that medical learning colleges are partly opened, and they are visiting the patients and they are trying to learn in some better way as they need some interaction. And this is the cases of online treatment. This is very easier for us. I also have helped this sort of things last few days back. When you feel that you are not in a position to hospitalize yourself, when you know that you need some regular checkup, because we know that in last 3 or 4 months, our especially our parents, those who are quite old, they need some regular checkups. So in that case, doctor helped us all around, that they are trying to give us some medical assistance via phone, via video chats. You can order your medicine, they will send you at your home. You don't have to come out. And booking labs are also very much increased. So many times people are hesitating to go to a directly lab. Instead of this, they are trying to book the person, book a lab booking, and the lab person is directly visiting your home, and they are trying to giving a test, and test report will come in online. So these are the few things also change our life. These are the new normal cases we can see. Actually, this is quite good for us. And many times also it is not effective, because we are having both the modes. So now you can easily go for this one. Now, the next case, this is one of the very important and challenging area, I think. And you have too much huge area of work. I personally feel so. So and here the data source and the data you will be getting huge. Already we know that we are quite correlated with all different sort of social media. Among them, few are microblogging site, few are not microblogging site, not microblogging. Say for example, in Facebook, you can type a lot of things, so huge post used to come. But in tweet, the number of words you will be writing, or the number of characters you will be writing, that is a specific one. So which is called the basically microblogging. Okay, so whenever tweet is quite an official one, nowadays Facebook is also official. So LinkedIn is also there. So now when we are having different sort of option of chatting with ourselves via this social media, for any particular topic, if you try to search, millions of posters are there. Okay, so this data you can easily download, and all these data are open sources. They are helping out. Twitter is helping out to give you all the data. And as we know, Facebook is also quite you can easily say Facebook is also quite open source. Facebook gives us data, user data. You can not too much secret data, but a very few data is open source. You can download that data and you can easily do your research on this. So I have mentioned here few of the topics which can help you out to do the research in further cases. So sentiment analysis is one of the case. Next, you can go for summarization of the global scenario, rapid dissemination of the educational content, and then the impact of some research domain. Definitely you can do data analysis of socio-economical impact and other data mining techniques. Definitely you can apply different sort of using data set. You can apply clustering, classification, spam detection, topic identification, regional information getting, different sort of things also there. Okay, so let's come one by one how you can do this. First of all, these are the few statistics which has been changed recently in our new normal scenario, where you can see that previously users are using less networking they try to do, or few of the person are doing networking. But nowadays it has been changed. Everybody is depending on the social networking too much, because not only it is for entertainment purpose, for our official purpose also we can use this sort of social media. So that's why this percentage has changed a lot. Now coming to the one by one of the major topics, that how you can do your research in different sort of social media analysis. First of all, I mentioned the sentiment analysis. So when any of the topic you try to post, based on this thousands of or millions of feedback used to come, and then you can collect the data. You can use different sort of model, that is deep learning model, you can use RNN model, you can use some CNN model, and you can try out come out with some sentiment analysis. Now how this sentiment analysis will come, say for example, you can see when the COVID scenario has come, people are try to obtain all the items from Swiggy and everything in such a mode that it is no contact delivery. So it means whoever the person will try to deliver that particular product, I will not touch this person. I will not just take the thing hand in hand. He will kept it somewhere and I will take it from there. Oh, and so when it is this thing will come their mind. Also they got this repercussion, then why to keep the money changing option? So then Swiggy, what it has been done, it has completely waived the cash pay option. It means you have to pay e-cash, and it means digitally you have to pay, then only the food will be delivered. So that is completely non-touchable. So actually they are trying to get this sort of sentiment from the user using some particular topic from the social media, and they are trying to implement this one. Similarly, you can see that in regional cases, which are the global brands like MACD, KFC, these are the global brands basically. So in all the regions, in all the country, the menu, the price, these are actually not same. So how the people will be liking, based on this they try to keep their collection. Not only this, if you see that pantaloons, if you have a pantaloons in an area where all are homely person used to stay, all only the simple customers used to stay, and in a very posh area a pantaloons are there the collections are also different. Many times you try to check it out. So basic based on the user choice, based on the user sentiment, this difference has been made. So all the business strategies are taken basically based on your outcomes. So you can see I have given a chart that how you can get different sort of positive, negative and neutral feedback in different cases. In case of physical stresses, if you think of physical stresses, this is one of the challenging topic in case of medical, in case of our case also, that how much people are getting depressed in lockdown, and how much they are actually happy when they will go to the office. So if you will try to find out the solution, you can easily get to know this sort of solution. These are the different point of research what you can do, and how the social is changing now. Statistics is saying in last 3 years in Delhi the pollution rate was quite high, but this year the pollution rate is quite low, because many of the person are not visiting outside, so the cars are not basically the cars are moving out very less. So that's why this time the cold is quite higher in Delhi, and the level of pollution is also low with respect to last 3 years, which is the good effect for us basically. So, and in Twitter also you can see Twitter, if you download Twitter data for specifically for sentiment analysis using streaming, data streaming, you can easily get this sort of data where some positive, negative and neutral marking is there. So it will help you to create a supervised learning model, and you can easily create your own test data, you can feed and you can predict some outcome. Okay, so these are the very important factors what you need to identify. So here another cases I was just discussing, so this sort of cases are just highlighted here. Next is, which is a very important topic, what you can where you can work, that is the summarization. Summarization means, as I told you, in any of the social networking sites, huge data used to come. So definitely this huge data, when it will be coming, then definitely this huge data, it is not possible for us to go through all the data. For example, if I just want to know that what is the current scenario of the new strand of COVID virus which has come, then if I need to know the answer, then definitely if you search in the Twitter with the new strand COVID virus or COVID virus scenario, you can say millions of tweets will be coming. So actually it is very difficult for us to find out the original information from this. So as a solution, we can create our own summarization model. Okay. Along with Python, one summarization model used to come, which is called SumBasic. Apart from these, many all inbuilt summarization method is also there. People have created so many summarization model. I also have one summarization model, so which can give some extractive summary. So I have mentioned here, you can see we can have two different sort of summary. One is abstractive summary, another is extractive summary. So what is the abstractive summary? Abstractive summary is one, if some event has happened and somebody is asking you what happened, so then in your language you are trying to summary the matter and you are telling something. So this is called abstractive summary, when the original content you are not putting originally, you are trying to mix up your own expression and making an actual summary and giving it to them. And we can have another topic which is called extractive summary. What is extractive summary? Extractive summary is one that you are having 100 data. Now you know that if you are having 10 data, this 10 data is sufficient enough to express your information. So you will only give the 10 data to the user, thus you go through all this thing, it is the fine enough. Okay. So this is called extractive summary. So these two sort of summarization models are there. You can work any on this. So this will also different sort of work already on summarization had been done. So you can use the COVID scenario and you can work with different sort of summarization model also. So these are the few summarization work I have done with my research team, and we have come out with this sort of things that as the new normal situation is there, everybody is sitting right back home. So how many person are watching web series, how many person are just giving their effort in research, how many person are listening music. So this sort of few researches I have come out with this. These are the outcomes, you can say, what we have gone through. Now also this model, I am as I told you that I am not going to bore you with all the statistics and huge formulas what I and other researchers have used in this paper. So for this reason, one small part of one research I'm showing you here. So this is one ensemble model. Just now I told you I have worked on a model which is the ensemble model. So this is the concept of ensemble model for which this topic I have embedded here. So already you can see that I have tried to find it out 9 inbuilt model. I tried to find it out for summarization, where already some work has been done. Few of the person have used social media data, few of the person used some other data. Okay, so these are the 9 models we have used, and you can see this scout model already is giving us some good results. So you can use Rouge tools. Rouge is a tool what you can use, and finding the root score you can easily say which is the good outcome model. So basically this scout is a technique which has been built up by IIT Kharagpur NERG team. So my guide was actually one of the part of this team. They have developed a model which is giving us 2 good outcomes. Okay, so based on this 9 algorithm, I thought this thing that why to inbuild another new algorithm which will give a little more benefit for this. Each and every summarization model has some good impact on some good databases, and that's why they established their model. So that's why instead of creating a new model, I have tried to propose some ensemble model. It means I have tried to find out the summary for all the using all these models, and I have tried to find out the root score. Then I have used 2 different methods, like one supervised method and another unsupervised method. And there I have tried to apply some voting approach. It means 2 of the summary is telling that this tweet is important, so I'm trying to include this one. So in this way I have tried to apply different sort of voting method, and this is the outcome I have seen. So I have tried out with so many combinations, and I can see this 4 outcome is coming so good for the unsupervised one, and this is the outcome. In the right hand side you can see this is the outcome for the supervised one, where you can see this particular model has come out with some good outcomes. So in this way also, this is the way as I was mentioning you the ensemble one, so this is the way how you can work also, and you can get some good outcomes with your different studies. Now come to the move to the another thing, which is the rapid dissemination of educational content. We know that being the teachers, we are using different sort of softwares we are using. So somebody is using Zoom, somebody is using Google Meet, somebody is using Team. Different softwares are using. So one sort of study model you can easily prepare, that those who are using, what are the feature you can analyze in Google's Google Meet, what is having in Zoom, what is having, and you can come out with the statistics and you can create a paper on this. And apart from this, the educational content, how you can distribute them, how it is available to them, that also you can easily create. And not only this, at the education media has been changed, also you can do research on this, that in what type of school in rural area, in very much popular area, how students are learning, how much student has been laid back, who are not getting assignments, who are not getting any sort of studies in last 1 year. It has also happened. I have attended one of the conference when the speaker, he tried to highlight that in rural area it is very challenging for them. They are trying to take the classes, but the below poverty level students, they are not able to do the classes. First of all, they are not having all this technical specification, they are not having internet, they are not having electricity even in some of the cases. So how they will work? So this sort of statistics using, also you can come out with different sort of papers. You are having scope for this one. And this is the one which is impact on research. So research impact is quite good. When people are getting too much time, people has tried to utilize all their effort. They are trying to do lot of researches in last 1 year. This range has been quite enriched, you can say. It's from January to February. Initially the situation was not good when the initial situation was coming, but after that we have seen the globally research domain has opened up. Everybody is trying to collaborate with each other. Definitely this nature was among us every time, but still the people all around the when this new COVID model has come, so definitely it is a huge source of research. All over the world, all over the researchers got a new topic, and various sort of researches are going on. A very few you can see I have tried to mention in my slide also, where you can work also in your future. And this is the data analytics of socio-economical impact. In respect to socio-economical, there are huge responses are also coming. So social media previously, that more than previous time, it has increased 50x growth. It means that huge number of users are using social media. Not only social media, you can see that previously how many persons are trying to use this Zoom, Webex and all this thing. Previously I can remember that most of the corporate person, they try to use all these softwares for their client meet. Now you see all the students, all the teachers, everybody is coming here, so their market is quite higher. So these are the cases also are increased. So apart from this, the sanitizers, those who are using the sanitization business, so different sort of business has quite enriched in the lockdown period. People are also thinking that they have to store more amount of groceries. They are also trying to buy, and the e-cash, this big basket, grocers, these has also just try to enrich their market. So these are the some social impact of what has happened. And this is one of the few of the cases. You can see a few of the strategies I have tried to find it out, that 80% of the social media user are connected with the Facebook nowadays. Few are time passing, few are doing some real good networking they are trying to do. 87% of user, they are trying to link up them user in the LinkedIn, and they are trying to take decision based on the LinkedIn information. They are trying to, the companies are turned up in that way. 77% top companies are using Twitter account as the important of the official account. You can see that our Prime Minister Narendra Modi, our Chief Minister in the different countries, all the politicians, all the players, they try to do different sort of tweets, and based on this, so many data are also being generated, and also we are having some outcomes that where we can do our researches. Next is this is last but not the least, one of the topic what I should mention, that when we are interacting so much, spammers are also disturbing us. Spammers are also making their place. They are trying to utilize all the information, and they are trying to also spread various fake information. So please don't forward. Also you can see WhatsApp has stopped forwarding a message more than 5%. So this is because of this sort of features, because if any message is a spam message, they will try to just pass on, then it will be spread too much. One message example you can see I have tried to highlight here. This sort of message also user are getting, that please click on the link below your COVID test to view your COVID test result. You need to enter your date of birth to see the result. First of all, a wise person will not do it, but there are not lack of foolish person in all around us. Those who will be clicking on this link, they will try to put their date of birth, and they will try to give some information. So that's why in this way spammers are also trying to find it out. You can work on this, that how to detect the spam. I've been showing you one example what type of work I have done by myself. So these are the some Twitter data I have tried to collect. Here I have shown my algorithm also. This paper is available in the Google Scholar also. So in Twitter we can have different sort of tweet we can get, and from this tweet I have tried to identify that what will be the nature of the spam and spammers, and then I have tried to classify using help of these features. I have tried to classify that whether a particular tweet is spam or not spam. You can see I have tried to break the entire features into multiple parts. The tweet based text, which means some text specs information will be there. URL based attributes will there. You can see those who are the spammers, they every time try to give some URL, and that URL is every time shortened URL. So if it is a shortened URL, definitely you can say that shortened URL can actually help you out to, if you click on this, if you don't understand, if you click on it, and it will help you to move to give your information to somewhere else. Okay, so apart from this, some user based profile attributes are also there, because if you see somebody is famous, they will try to they will have more follower, they will try to follow more person, that they can reach out more number of person. Their user status count will be huge, they will try to repost some fake messages. So these are some user based factors. So using this, I have tried to apply some rough theory based model, and these are the results what I used to got, that from another feature selection based model, my proposed algorithm, you can see it is giving some good outcomes. Only for one data set I got exactly almost similar outcomes, so I have tried to find out some statistical test which is also telling me that my proposed method is working fine on this data set. Okay, so these are the some outcomes what you can see. And also here, what I haven't mentioned previously, here we are having good chances to create IoT projects, and you can patent your file for the IoT, because nowadays you can see in the COVID scenario, robots are coming, smart gadgets are coming. Just you think this sort of project already we have done with our students, that one gadget will be there which will scan your temperature, or you can create this sort of using sensors and IoT, you can create this sort of IoT project that in a room you can just try to find out the crowd analysis. If the crowd is too much, it can give you the warning that too much person cannot allowed. If you are traveling in a car, you can embed this sort of gadget of crowdsourcing. If you can accommodate this crowdsourcing model in the lift where a limited person should go, so this sort of things also you can apply. Nowadays in the market, too many robots has come. Those definitely in all the states, everywhere it is not happening till now. But in Maharashtra, in Kerala itself, it is happening. I will show you a very short video before concluding my slides, which is very interesting one. Let me show you the video. Yeah, let me show you the video. Very sorry, it is coming so quite late. Yeah. Okay, so this is the this was the video actually. So let me get back to the slide again. I'm just end of my presentation. I think my screen is visible to you all, right? So
Yes.
these are the some research areas actually I want to highlight, as it is a FDP. So I'm again and again motivating you all that you have a huge source of going through the research, that how the vaccine development, when you can see that if people are getting afraid to taking the vaccine at the time of vaccination, how they are trying to do the vaccination, how vaccine has been developed. On this also you are having few areas of researches, the medication, healthcare, social, economic, environmental, sustainability. In all the areas you are having too much industry 4.0. And what is our mental health, the importance of our home life, how it is going on, how the relations are carrying on. So mainly in on entire thing you are having too many chances to explore yourself, to explore your researches. So this is thank you all of you that to give me to have patience and to listen me with all your patience. So thank you, thanks a lot. I'm just stopping my share.
Okay. Thank you very much, ma'am. It was a
Yes,
very nice and wonderful lecture related to data retrieval in the era of COVID-19. Ma'am, we have few questions.
yes,
The one
sure.
question is from Mr. Sukalyan Som. He is asking
Yes.
that how we can get radiological and pathological data related to COVID-19.
Yeah, pathological and the radiological data few are also available, sir, in the website Kaggle. If you want, you can download it from there, or if you couldn't find, then also you please try to get in touch with some medical team, those who are basically handling with COVID. They are ready to, every all the doctors are ready to definitely give all the data in most of the cases. But I am quite sure you don't have to go visit up to any doctor. In the Kaggle, so many data sets are available, you can get it from there.
Okay. Ma'am, next question is from Priyanka. She wants to
Yes,
know
yes.
how we can assemble all the data sets related to COVID-19 on a single platform.
On a single platform, if you want to assemble, this is quite different, because what type of data, as you can see, I have discussed here too many points. I have discussed here chest related data, so which is a data which is responsible, quietly responsible for your image processing. If you want to collect social media data, that can be collected from Twitter, you can easily get from Facebook. I will prefer that if you collect it from Twitter itself, because this is the good one, if you try to collect from Twitter. And several different sort of data from Worldometer, you can get the statistical data. So in one single platform, you can just visit Kaggle. It is a very good website. I'm giving you, give your topic name, different type of data will be available there.
Okay. Thank you,
I have
ma'am.
myself collected different sort of data from there self.
Okay. Thanks, ma'am. Ma'am, next question is that how we can use artificial intelligence for improving our health system.
Yeah, artificial intelligence, first of all, the last example I have shown you, this is the best example what you can do, that the robot, though it is really not possible for us to create the robot, but at the end of my presentation I told you, you can create this sort of gadget, which are very small gadget, which can help you to be careful that whether person is having some fever or not. This sort sort of things you can easily identify. Say in your office, when we go to our office, we try to check this thing every time. You see that we sanitizer is given to us and our temperature are getting measured. So this is fine enough. Many times when we are try to sit in a position and try to discuss, then this sort of gadget, if it is installed in our room, that crowd will not be allowed it. So it can give you a buzzer. This sort of small artificial intelligence system you can create. Definitely the small gadget you can create, and definitely this sort of gadget, if you can make a good project, you can file your patent. You can definitely make it sellable to the market itself. It will be very effective for everywhere, in the mall, in the shopping mall, everywhere it will be accepted. It will be a sellable product itself.
Okay, thanks, ma'am. Ma'am, last question is from my side also.
Yes, sir.
Means during ensemble process, what should be the important factors that should be taken into consideration? Means when we talk about ensemble algorithms, so what are the important parameters that should be taken into consideration when we go for ensemble?
Yes, first of all, that in different cases will be different. Say for example, that one example I have given you for summarization. That summarization where I have tried to find out the outcomes of different model. I have taken the root score basically, which is the score which shows that how good summary you have tried to identify. Okay, so this is the case of summarization. Say for example, you want to identify something, that clustering. Okay, you want to apply some clustering model, then you take the another clustering model. You can use some incremental clustering model, some generic clustering model, k-means model. You try to try to find out all the outcomes. Then you check each and every entry is getting how many voting it is trying to get. Say for example, clustering means once if you are having 10 items, I'm trying to break it into 2 different clusters. Okay, 3 items in one cluster and 7 items in another cluster. Now you try to apply different sort of model. You can see k-means and density based algorithm, incremental clustering will not give you same outcome. So different clustering algorithm is giving you different clustering outcomes. Then you try to apply the voting method, that for a particular method, for a particular element, how many voting you are getting, that whether a item number 1 is getting how much voting to stay in one cluster number 1 or cluster number 2. Using this, you can use some voting method. This will be the supervised one. Apart from this, you can also consider some cluster efficiency. For example, as I mentioned, that in case of summarization, you can use Rouge. So in case of clustering, you can take help of different cluster measures also. Like you can use DB index, Dun index. You can find out the indexing, and you can easily find out which cluster is giving you good outcomes. So you will try to take help of that clustering. Then you ensemble one. So whenever you try to apply the ensemble one, also use the voting method. Once you please check in the Google, different sort of weighted voting, without weighted voting, some binary voting, different methods are available. You can easily apply it, and this is a very good area of research, because every time really it is not possible for us to find out with some new exceptionally very good classification model, clustering model. Then here you can apply this sort of model. It will give you definitely good outcomes.
Okay, thank you very much, ma'am. Thanks a lot for such a wonderful and informative session on data retrieval. Now I would like to call upon Priyanka Roy for further proceedings.
Thank you, sir. Thank you for a good question answer session. Thank you, ma'am. Now, on this note, I would like to call upon Dr. Pranay Divate for vote of thanks.
Thank you, Ms. Priyanka Roy, for inviting me for propose a vote of thanks. It's my privilege to have been asked to propose a vote of thanks on this occasion. Myself, Dr. Pranay Dutta, Assistant Professor at Center for Climate Change and Water Research, Gyanwal University, Jaipur. On behalf of Center for Climate Change and Water Research, Gyanwal University, and my own behalf, I would like to thank Dr. Soumi Dutta ma'am for such an enlightening and informative session on information retrieval in post-COVID-19 in the light of data analytics. It's well said that information is the oil for the 21st century and analytics is the combustion engine. We all can have get an idea in the last 1 hour that how the data has been used, how the information is used in a different approach, different direction. And this is such a wonderful talk, ma'am. I would like to again thank you for giving insight about the data analytics and how we can use the data in different domains. I would like to extend my sincere thanks to Honorable Chairman Sir, Honorable CM Sir, Dr. Shruti Ma'am, Dr. Suraj Sir for giving a motivation and encouragement for conducting this FDP event. I would like to grateful. I am grateful to all the participants from different reputed institute for attending and participating in this FDP event to make this event a successful. I also extend my thanks to Dr. Varun Mishra, Ms. Priyanka Roy, Mr. Rishabh for successful organization of this event. I hope all of us, including me, had learned a lot, and we all are looking forward to seeing you all in the next event. Thank you all. I request
Thank you.
Mr. Rishabh to please take the photographs. I request all the participants to please turn on the videos so that we can have a group photograph.
Thank you, Dr. Suraj sir. Thanks a lot, and thanks all of you. If I can help you, if I can motivate you that you can continue your research, and for any sort of help, definitely you can contact to me anytime.
Okay, thank you, ma'am. Definitely, it will be good for us to work in machine learning and deep learning methods.
Yes, we can do definitely some collaborative work also in future. Definitely feel free to contact me.
Okay, thank you, ma'am. Thanks a lot. Okay, all of you, please turn